Starting today, the United States is going to be barring travelers from several African countries in a bid to at least slow the spread of the Omicron coronavirus variant. Its numerous mutations are sparking concern for the World Health Organization. At least 14 countries across the globe are already reporting cases. Our Debora Patta is in South Africa, where scientists there first identified the variant.
This lab here in Durban is where the country's top scientists are racing to find out whether existing vaccines will stop Omicron. Within 36 hours of discovering the new variant, these researchers alerted the world and immediately began testing it. But instead of being applauded, many believe South Africa is being punished for its excellent science.
The masks may be back on, but the gloves are off in the global fight to stop the new strain. In just a matter of days, Omicron has become globally recognized and is stalking the world. As of today, a travel ban will prevent most travelers from Southern Africa from entering the United States. And restrictions have been renewed for travel from Southern Africa to many European countries. Europe was already the epicenter of an alarming surge in COVID cases before the arrival of Omicron. Israel has gone one step further, prohibiting all foreign travelers. With the variant already confirmed on 5 continents, South Africa's President Cyril Ramaphosa is calling for travel bans to be reversed, saying they have no basis in science.
Now, these restrictions are completely unjustified and unfairly discriminate against our country.
But world leaders have committed to slowing the spread while they wait for the science, because there's a lot we don't know. Omicron is potentially more contagious than previous strains, but its severity is still unclear. It contains about 30 mutations to the spike protein, prompting concerns from some scientists it could be vaccine resistant. Professor Anne van Gotberg of South Africa's Institute for Communicable Diseases told us there will be answers.
I think there is good reason to be worried. I don't think that means that we're powerless. We need to collect data, we need to investigate and understand this variant.
Scientists won't know those results for at least 10 days, but South African doctors are starting to see an increase in reinfections in people who've already had COVID. Numbers are still low here, but Omicron accounts for the more than 2,000 daily new cases in South Africa. Vlad, Anne-Marie?
All right, Debora Patta reporting for us from South Africa. Debora, thank you very much. Let's bring in Alonzo Plough to discuss this variant. He's the Chief Science Officer and Vice President of Research, Evaluation, and Learning at the Robert Wood Johnson Foundation. It's good to see you. So the Omicron variant's high number of mutations is a major concern for doctors and researchers. Dr. Anthony Fauci spoke about these mutations on CBS Mornings earlier. I want to play what he had to say, and then we'll talk about it.
It is having a degree of what we call mutations around that part of the virus we call the spike protein that is responsible for the binding of the virus to cells in your body. So when you have mutations, and there are about 30 of them there, which are really a lot of mutations, which suggest that this would be more transmissible and also suggest that it might evade some of the immune parameters that we have, such as monoclonal antibodies and convalescent plasma.
So, Dr. Plough, explain why these mutations are so concerning, and have they been seen in other variants?
Well, yes, they've been seen in all the other variants. And as Dr. Fauci was saying, the vaccines are designed to protect against the spike variants that are known, to have the body respond and attack against those spike proteins. So when there are new spike proteins or variations in spike proteins, then there's a question about how effective the current vaccines would be. But I would add that we have no information yet that the current vaccines are not protective, at least from severe disease, from this variant.
So what we also heard is that South African doctors are seeing an increase in reinfections in people who already had COVID-19. What does that suggest about this new variant and natural immunity?
Well, again, it is troubling, but we still have a lot more to learn around breakthrough infections. Again, there are breakthrough infections that have been happening with the Delta variation. A lot of that is really based upon a particular individual's own health status. But I think, again, the message is there's much more to learn about this variant. And the real message is that vaccination and booster shots are the path forward, because the viruses only mutate when we do not have widespread vaccination in this country and globally.
So one of the things that I'm curious about, Doctor, is as the headlines begin to blare, because it's important to note that these countries, several countries, are restricting travel and in some cases banning travel from other countries into their countries. But what we've been saying all along is we really don't know that much about this new variant. We don't know how quickly it spreads. We don't know if it's capable of causing more serious disease and whether it's able to circumvent the immune protections that, as Anne-Marie pointed out, that may be left behind by SARS-CoV-2 or the COVID-19 vaccine. So how are we to frame this for a public who might be naturally worried about what could potentially happen in the next couple of months?
Again, there are things that we don't know about this particular variant, but there are things that we do know and that are highly likely, and I think Dr. Fauci spoke to this as well. The current vaccine is protective against particularly serious illness that occurs from even the Delta variant. So we have seen new variants, and the vaccine is quite good at protecting against serious illness, even if it is a little less good at protecting initial infection. That is super important because that is what prevents deaths and serious disease. So we know this, and there is no data to date that the vaccine would not have that similar kind of effect that it had with Delta. We are absolutely not back to square one. And it's actually great science in action that this can be so quickly identified, and that Moderna and Pfizer are already working on the possibilities of a modified vaccine. And we have this kind of global surveillance or monitoring to relatively quickly find this variant. And that is, we are more along than we were this time a year or so ago.
So I know we still have a lot more to learn about this new variant. I'm curious about what that process is to learn a lot more. Do we have to wait until there's natural spread in populations and then we look at the way this variant moves? Or is this something that happens in a lab? Is this something that, can we learn more about it in 2 days, or is it going to take 3 weeks? Can you give us a little more insight about just how that works?
Certainly. Right now, the scientists both at Moderna and Pfizer and around the world have already profiled and modeled this particular variation. I mean, that's amazing in itself. So there are already descriptions that allow them to develop kind of experimental versions of it and test it against the vaccine. That is going on right now, and I think we're talking about, a matter of days and weeks before information will be able to be shared from that work. So most certainly, we do not have to wait for this variant to spread through the population. But again, the continuing story of the pandemic is that we are protected when we have extensive vaccination of all eligible to be vaccinated. And then the other part of the story, given that the variants have been arising in countries with low vaccination rates, we aren't safe in the U.S. until the entire world has access to vaccination. Everyone is about a plane flight away, 5 or 6 hours from everybody else. And so the vaccination is the key. So get vaccinated if you haven't, get a booster if you're an adult and you're eligible. That is what we need to double down on in response to this new information about the variant.
Yeah, and Dr. Plough, Dr. Fauci spoke about these travel restrictions that have been imposed by the United States and other countries and whether or not it'll have an impact on the spread of this new variant. Dr. Fauci on our air said that, of course, this isn't meant to stop the variant from spreading, but it's to buy this government, other governments time to understand some of the things we're trying to understand. But the question still remains, and it's something that Debora Patta brought up in her own reporting in South Africa. South Africa's scientists, who are stellar, who are amazing at what they do, first notify the world that they've uncovered this variant, and the first thing that the world does is it shuts down travel between that country and other countries in South Africa. Meanwhile, the infection rates and the death rates in the countries that are shutting those borders down, like the United States, UK, Russia, et cetera, are higher than they are in South Africa. And you compound that by the fact that Western countries have, for the most part, hoarded the vaccines and have not yet been able to get them to places that need them most, as the countries we're highlighting here on a map. So how much does that play a role in the fact that the vaccines are not available to these countries that we're showing on the map in the same scale that they are available in the West, and whether or not this is really the right answer, as opposed to, doctor, doing the things that we know works, wearing a mask, washing your hands, keeping socially distant when possible, wearing a mask indoors, being tested regularly. I mean, those seem to me to be the things that we know work versus a travel restriction, which is not clear that it does.
Well, you raised a lot of really good points. So let me deal with the first one. And I mentioned this before. There's an inequity in the lack of distributing vaccines, particularly in the developing world, and providing sufficient access to all people for this very, very effective vaccine. The very low vaccination rates and the low supply of vaccines in South Africa is a problem. It needs to be addressed globally. And you're exactly correct that that is one of the underlying issues. Second point you raised is also really important. All through this pandemic, the hope and our protection relies in basic public health precautions. Masking, social distancing, and being vaccinated with the effective vaccines and boosters that exist. So all of that is true. Travel bans are I think, as Dr. Fauci said, an initial and hopefully short-term reaction to, as he said, to buy time while the scientists work in the laboratories to actually provide more clarity about the situation that this new variant represents. So it buys a little time. But again, the essential unfairness is the lack of adequate access to vaccines in the developing parts of the world. And until that is remedied, there will be more variants, and we will repeat this cycle unnecessarily.
Alonzo, Plough, thank you very much.
Thank you.